There's going to be a massive change in the way we take care of people compared to the way we do it now. The traditional system in healthcare and the role of doctors and nurses is, especially in the West, a very much top-down approach where the doctors and the nurses, the so-called healthcare professionals, tell the patient what to do and what not to do. And this is going to change. The future role of healthcare professionals is going to be the evaluation of the change of consciousness of the patient. Why the change of consciousness? Because it reflects the amelioration or the aggravation of the health of the patient. So consciousness is the very bottom of healing. And the healthcare professionals going to evaluate this change in consciousness through listening and through observation. Because it's through listening that we access patients' sensations, their pains. It's through observation that we see how they move and how they talk, the body language, all these subtle components in the patient-doctor interaction. And the big question is, which role a medical software going to have in this new way of taking care of people? And the medical software going to have an absolutely crucial role, because it's the medical software that determines what we can actually document and not document, what we can transport to other players in the healthcare system. So the medical software, most medical softwares, they are structured today, are very much just diagnosis oriented. And when we evaluate consciousness and access in a skillful, artful way patient's inner life, we actually access the subjective world of the patient. And that's a layer beyond the diagnosis, which of course is still going to play a role. And we should have a system or medical software available that allow us to document in a quick and concise way what the patient experiences, meaning what the way he thinks, what he feels, and what his ideas of the future are, where his life in general is heading. So medical doctors and nurses, the healthcare professionals, going to be next to those people who really want to grow and evolve. And medical softwares of the future going to be tools that basically document the evolution of a patient. And so it's not just diagnosis centered, it's going to be much more subjective, inner world centered. And this, of course, needs tools that allow us to synthesize not just what we observe and see in the consultation, but also what we get in terms of objective data. So the objective part is still going to be very important, like the lab results, the radiology results. All this still is very important, of course, especially when we have to deal with acute situations. But most of the situations we see in the populations are chronic situations, and there we need a different approach. And the medical software of the future going to allow us to synthesize the subjective part and the objective part. Now, and a crucial step I think we need to take in the future is that we give patients more responsibility, and we can do this by giving them access to the medical record. And this, I think, will allow us to create more order and to reduce the chaos, because healing basically is about creating more order and more structure and more stability. And by integrating the patient through giving him access to the medical record, this is potentially possible. It might not be possible for all the patients, and the doctor have to choose which kind of information you're going to share, because the information might be a source of fear and anxiety. So this needs to be individualized. But by giving them more structure and more information, patients are going to learn through this information. So it's going to be a more flat collaboration than a more top-down collaboration with patients in the future. And the medical software is the key tool to allow us to do so, and to share the information then with other players in the medical field.